Got a positive C sign for hip impingement? Here is the number one exercise I want you to start with. You're going to begin on all fours and perform a rock back, moving your butt back towards your heels. Be sure to not hold any extra tension and allow your hips to move freely into that flexed position. I want you to imagine the head of your femur driving backwards into the socket as you sink back towards your heels. The other really important piece is to make sure that you don't round your spine when you sit back, but to maintain a neutral position throughout the entire motion and your hips nice and relaxed. One of the biggest reasons that you're going to feel pinching and pain on the front side of the hip is when the head of the femur isn't moving properly in the socket. Whenever we flex our hip, the head of the femur has to stay centered, which means it has to move backwards into the socket a little bit. If it doesn't move back into the socket, it kind of comes forward, and that's the pinch that you feel on the front side of the joint. So when doing this exercise, imagining the head of the femur driving back into the socket is going to clear that space, and it's going to help take away a lot of the compression and the resultant inflammation that you get on the front side of the hip. Unless you learn how to move the hip in that exact pattern, no amount of surgery or exercise is going to make your hip feel better. You must learn the proper movement patterns to take the impingement away. Even if you have surgery, many surgeries are failed and don't work because nobody's ever taught you how to move properly. So learn this piece and then everything else can follow.